Good morning, everyone. My name is Mary Jones. I serve as chair of the Marriage and Family Therapy Advisory Committee of the Kansas Behavioral Sciences Regulatory Board. I ask the members of the advisory committee to signify their presence in roll call, that this meeting is being conducted remotely by conference call or other electronic medium. Betsy Henderson,
Present.
Marcy Lechtenberg,
Present.
Diane Siebel,
Present.
Heidi Vella. I noticed that I'll also note the following BSRB staff are present, and that is David Fye. Next, David will read a message concerning this meeting being held remotely.
Thank you, Mary. This is David Fye, Executive Director for the Behavioral Sciences Regulatory Board in Kansas. Public comment allows the public to address the advisory committee about any concerns, but the Kansas Open Meeting Act, or the KOMA, does not require the advisory committee to provide public comment or answer questions from individuals. Individuals requesting to provide public comment to contact the executive director prior to the meeting by sending an email to david.fye@ks.gov. No time has been reserved for public comment, as no individuals have requested time for public comment. Because we are conducting this public meeting remotely by conference call and other teleconference ability, I state for the record the following information. Public access to this meeting is being conducted by a medium of interactive communication that allows members of the public without cost to attend the meeting through the use of the conference call and on the board's YouTube channel. While the meeting is conducted remotely, the requirements of KOMA are not suspended. Therefore, we will be conducting this meeting pursuant to the KOMA. On March 12th, 2025, we sent notice of the advisory committee meeting to all individuals that requested notice of such meeting. The notice is also posted on the board's website, ksbsrb.ks.gov. You may obtain a copy of the notice at that website. An agenda and other media material were posted on the board's website and are available for review. You may also request a copy of the agenda specifically by sending an email to david.fye@ks.gov with a subject line request for the agenda, and it will be sent to you. The notice contains information for the conference call and YouTube channel that allows members of the public to attend the meeting free of charge. The notice also states that if we have any technical issues during the meeting, you may contact the board office at 785-296-3240 or send an email to bsrb@ks.gov. A recording of this meeting will be available on the BSRB YouTube channel following the conclusion of the meeting by using the link to the meeting on the agenda. And the conference call line is active. I did check it before we got started. There's no one currently on the line, but if I hear someone beep over and announce themselves, I will let you know.
Thank you, David. Appreciate that. The first item of business today is approval of the agenda, which you received in your packet that was sent yesterday. Any questions, changes? If not, I'll take a motion to approve.
I move to approve.
Thank you, Betsy. Is there a second?
I second.
Thank you. All those in favor say aye.
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 Any opposed, same sign. Great, thank you. The next item of business is reviewing and approval of the minutes from the last advisory meeting, which was in December. And if there aren't questions or comments or corrections, I'll take a motion to approve.
I motion to approve.
Heidi, thank you. And that was that Marcy second?
Yeah, I'll second.
Okay, great. All those in favor, please say aye.
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 Any opposed, same sign. Okay, thank you. David, I'll hand it over to you for your director's report.
All right, thank you, Mary. Normally I go through some operations updates for the BSRB, a few legislative updates, and then I always want to keep the advisory committee informed about items from most recent board meetings. So I'll touch upon a couple items from the meeting that took place last month in March. So starting with some BSRB operations, we are in a time of transition. We are going through and updating a lot of our technology. About 4.5 years ago, or right after I started as executive director for the agency, we replaced a lot of our desktop computers with laptop computers. As you may recall, we were in a very different time with the pandemic, and it was helpful for staff to be able to work remotely with some of those devices. We were also going under the state's enterprise as a service licensing system. So that way we could use technology with the assistance of the Office of Information Technology Services and get support from them. And so that worked out well for us, but those leases are coming due. And so we are updating and switching over to new laptops. So there's a couple of technical issues we're still working out, but for the most part, the transition has been fairly smooth. Also an update for you about CE Broker. I just want to let you know that we have fully transitioned over to working with the e-broker. A lot of the comments that we have received, the majority of them have been positive from licensees. This is, if you're not familiar, if you're just finding out about the e-broker, it's something the board has been working on for about the last year. There's a company that offers a free service to licensees as a way to keep track of your documentation for continuing education. So if you are selected for audit when you renew your license, if you have used that service, you can have us check the portal and verify that you completed all of your hours, and you can assign them in certain categories. We did make sure the arrangement we had with CE Broker was that this would be a free service. The version that we have right now does not prevent anyone from moving forward on their renewal if they're not using it. It's an optional service. It's a free service. The company does have some other tiers of paid services, but they're not mandatory. They're just discretionary if people want to utilize those services. So we have heard a few concerns about some of the process with continuing education providers registering under CE Broker. So we'll probably set up a meeting sometime in the next few weeks to sit down and just get an update about how many people have used their services, if they've received any direct feedback, and then see if we can kind of work on that process to make sure that things continue to work well. And so I just want to let you know some updates there. In terms of other operations updates, we're moving towards the middle of the year. So a lot of the national associations we work with are holding mid-year meetings. So I'll be attending a couple of those coming up in the next few weeks, one for the Social Work Association, another for the Psychology Association, and then later on this fall, we'll be attending the annual meeting for the Marriage and Family Therapy Association as well. So looking forward to continuing to develop good contacts with those national associations and appreciate the support that they offer back to us as well. Shifting to some legislative updates. So the legislative session is at the finish line, I think, fingers crossed. You never fully know, and legislative session does change year to year, but in general, they try to stick to about 90 days in Kansas. And so it's every spring, usually about the second week in January, and then sometimes through about the beginning of April or the end of April, sometimes the middle of May. I've seen it go as late as the middle of June, but this year they are trying to stick to the 90 days, and I think that would probably end, I believe, tomorrow. So they just came back from one of the legislative breaks yesterday and worked on a few bills. Basically what happens is the legislature has different phases, and they will introduce bills, they will have hearings for those bills in committees, and then they will try to pass them in the chamber of origin. So if they're House bills, they'll try to pass them on the House floor. And then if they are passed, they will go over to the Senate, usually be assigned to a Senate committee, receive a hearing, and then they will be passed on the Senate floor. If there's items of difference, there's a concept called a conference committee, where the leadership of two different committees will come together, try to work out a compromise solution, and then that compromise solution will go back before the floors of each chamber. And if that passes, it will go to the governor. At that point, the governor will have three different options. Either the governor can sign bills into law, the governor can take no action, and if the governor takes no action for several days, that bill will ultimately become law without signature, or the governor can veto. And in general, the governor has the authority to veto entire legislation. When it comes to things like the appropriations bill, the governor has the ability to veto as a line item veto. So the governor can veto specific sections of an appropriations bill rather than the entire bill itself. And so where we just came back from, the legislature returned from about a week and a half to 2 week break after passing some legislation on the floor. The governor did veto a number of different bills, and now the legislature has the opportunity to decide if they want to override those vetoes, which would require a 2/3 vote by both chambers. Similarly, any of the line item vetoes for the appropriations bill would require a 2/3 vote in both chambers as well. And so I understand yesterday there were a few different attempts to override vetoes. Some of them were successful, some of them were not. I believe more of that will take place today. The legislature also has an opportunity at this time to pass any additional legislation they may want. However, if there is not another day reserved later on, there may not be an opportunity for the legislature to come back, take action based on possible governor action. So that is where we're at with the session. The legislature has passed an appropriations bill. The governor has signed that bill with some vetoes. They're just resolving those issues right now. In terms of the BSRB budget, the legislature did recommend the same amount that we had requested when we submitted our budget. When we submitted our budget, we came in about $40,000 under what we were approved for this year. We have some small increases in the next 2 fiscal years, but those amounts of increase were both recommended by the governor's office and also the legislature when they were going through and considering agency budgets. So nothing that we have before the legislature right now is likely to be subject to any kind of action. So I think for the most part, our budget is kind of done for the year. In terms of any other type of legislation that might affect the BSRB, we are trying to monitor that to see. There are some broad bills that would affect regulatory boards. One of those bills that was before the legislature this year had to do with exempting military spouses from certain licensing fees. Previously, the language of the statute said they would exempt military spouses of active duty military members, and the change this year was to remove the word active. So it will increase the number of military spouses that are exempt from licensing bills or licensing costs. It's hard for us and actually impossible for us to know how many individuals that's going to affect. So we do know that we will see a decrease in revenue, but we're not sure the amount. But we feel that we should be able to absorb that amount, but we'll try to monitor that after the bill becomes effective. There was also another bill called Senate Bill 63. It was known as the Help Not Harm Bill. I know there was a lot of confusion about that bill, and we received a few questions about that here in the office. We do want to be helpful to individuals. It's just a very difficult bill, especially for our agency to work through. So we are trying to work through that. At the same time, we're also trying to be consistent with our role that our office has provided in the past. We don't provide legal services to licensees. We don't provide legal advice. And we don't usually interpret statutes, especially if it's not a bill that was put forward by the BSRB. If you're familiar with that bill, there are certain restrictions on certain practices and activity for certain medical providers, but a lot of the language in the bill speaks towards medical procedures such as surgeries. Some of it talks about referrals. Some of it talks about prescribing medications. So not all the practices that are described in that bill would follow the practice of our licensees, but there is some broad language that talks about healthcare providers. And so we are continuing to review that. We are asking individuals to be diligent and review the statutes and bills that are passed. While we can't provide legal advice, we do find it helpful sometimes if individuals consult with their own legal counsel. So if individuals may benefit from that, that may be something that they could consider. If the board does take make a statement on the bill or take a position on the legislation, we will be sure to keep you updated on that. I believe right now it's a challenging time because we're trying to work through some of the provisions to make sure that we have a good understanding of the bill. And part of that we're doing with legal counsel. And so, like I said, if there are additional items on that, we'll be happy to let you know, but we're still working through it ourselves. In terms of other items, like I said, the legislature is about wrapped up to the session. Normally when the session wraps up, the legislature continues to meet at times in the fall for interim committees. Some of those committees tend to have a health focus. Right now, we don't know what those committees are going to be, but we'll try to keep an eye on those when they get requests for approval for interim committee meeting days. And we'll let you know more about that. In terms of just other updates, real briefly, I mentioned we try to keep the advisory committee members updated about items from board meetings, and the board did hold a regular board meeting in March. One of the main takeaways from that is we really appreciate your work as an advisory committee, as well as the work from the other advisory committees, as the board has gone through and done a very diligent progress and really hard work looking at the unprofessional conduct regulations for all the professions. And so the advisory committees have each had a chance to review those unprofessional conduct regulations, make recommendations on changes. After that point, we forwarded back all of the committee's changes to the other committees so you could see what recommendations other advisory committees had made to see if you would recommend the same things for your professions. And then those were brought forward to the board. As a next step, we have, I've asked my staff to provide assistance with this too, but here in the office, we've created a very big grid of the unprofessional conduct regulations. so that we can have the board see clearly the language that is appearing in the professional conduct regulations across the profession. Some of it is fairly uniform and some of it is not. And the question before the board now is whether the board would like to modify the language to have more uniformity on some of those issues, or if the board would like for there to be some difference per profession, if that is something significant to the profession. So if you are interested in that topic, I would encourage you to take a look at the items that are posted on the website from the last board meeting. We did have a rough draft of a grid. We've continued to work on that, so we'll have another version of that, but most of the items in the professional conduct regulation are posted there. And the ultimate goal is we can have as much standardization as possible, while also preserving the items that are important to the professions to be unique, and then bring those forward as possible changes to the regulation and have those implemented. And when we first started this project, we knew it was going to be a major undertaking. Some of those regulations had not been updated in over 20 years. And so it was a big task, but I think we're getting close to the end. And I think when we do finish this task, the board will have a really good set of unprofessional conduct regulations, and it'll be much more clear to practitioners and applicants in terms of what their expectations are concerning the unprofessional conduct standards. With that, I'll go ahead and end my report and see if there's any questions from any members of the committee.
Thank you, David, for that report. It doesn't look like we have any questions or comments from what you said. So, not hearing none, then I think we'll move on to the next agenda item, which will also have you giving us quite a bit of information here as we look at the review of the survey.
And did you want to discuss the artificial intelligence topic first under?
Oh, yeah, I'm sorry. I was sort of going out of order there too. So, yeah, let's go ahead and let's do the artificial intelligence items first.
Okay.
Which also you have sent in your packet of items.
Yes, and so this has been kind of a continuing topic. The board started this discussion and deferred to the advisory committees to have discussion on this topic. Basically, how to regulate artificial intelligence. What should the role of the board be? And how can the board provide guidance to licensees and applicants in terms of the use of artificial intelligence? How best can that be approached? And each of the advisory committees has been having discussions on this topic. You have had a guest speaker that's come before your advisory committee, and I know other advisory committees benefited from that too. I know they went back and they reviewed that. In your packet of material, I included some additional items for your review and consideration. There's 4 separate handouts, and I thought I would briefly just kind of talk about those for you today. So the first item in your packet of material is a short document, and that is from the BSRB. Basically, this is from what state agencies are asked to follow in terms of the use of artificial intelligence. It is a generative AI policy that the legislature or the governor's office has implemented for any agencies under the executive branch, which does include the BSRB. And the policy is not very long, but I thought it might benefit you just to kind of see what direction we as a state agency have been asked to follow. Now we have asked for basically a meeting with some representatives from the governor's office just to help us understand a little bit more how we can develop an agency-specific policy. So we're still going through that process, but I'll go ahead and share my screen here and just kind of show you that document. This was put out back in July of 2023, and we have been able to talk about it with some of the representatives from the governor's office and from the Office of Information Technology a couple times. But this was a 3-page document. Its purpose was to outline the acceptable uses of generative artificial intelligence. And I know that there is some discussion about what is artificial intelligence, and some people's understanding may be different than others. This focused on generative AI. And so basically, it talked about individuals using technologies such as ChatGPT, DALL-E, OpenAI, Microsoft's Bing Chat, and 365 Copilot, and Bard from Google. And basically what it just kind of laid out there was some general definitions of what generative AI really is. It referenced the ITech policy, which also state agencies are asked to follow. And basically it indicated that, you know, you may use certain AI tools, but you are limited in how you can use them. What we have done is that if we wish to use any AI tools, we have run them by the Office of Information Technology Services to ensure that they approve our use of those different things. And right now, we have a very limited use of anything like that. But basically, under this responsibilities, part of this is saying that, you know, generative AI is not meant to be a replacement. It can be a tool to assist, but it should not be used verbatim. It should not be assumed to be truthful, credible, or accurate, not treated as a sole source of reference, not used to issue official statements, or relied upon for final decisions, or used to impersonate individuals or organizations. So they put this out here to let us know what we could use it for, what we couldn't use it for. There's also some information there about copyrighted material and others. So thought I would share this with you. Like I said, it's a real short document, just 3 pages long, but I thought you might benefit from just seeing what guidance and restrictions we have been asked to follow as a state agency. The second document that I provided in the packet today is from the National Board for Certified Counselors. And I know this is a different profession, but I think we're all sort of wrestling with these similar topics. And I thought you might benefit from some of the guidance that they provided. It's a real short document, it's 4 pages long. But some of the things that they were talking about was, as we're looking at AI, some of the things to keep in mind when considering policies are things like accountability, client welfare, competence of the AI, competence of the individuals using the AI, and then ensuring confidentiality. And then also ensuring that individuals have a good understanding if you're using AI. So topics like transparency and also consent are 2 of the topics they wanted to emphasize. And then oversight, accountability again, and then confidentiality, client welfare, uses of AI in terms of telemental health, and then some guidance concerning supervision, counselor education, testing, research and reporting, and then gatekeeping and advocacy. So there's a little bit more. There's some directions here to some NBCC directives that you may find helpful as well. But I thought I would provide another short document from NBCC that dealt with some of the topics as we look at artificial intelligence. The next document is from the American Association of State Counseling Boards, AASCB. And this document really focuses on essentially how to support the safe and ethical use of AI in mental health counseling. So it's a little more geared towards practitioners, but also a tool for regulatory boards as you're looking at how to approach this topic. I think one of the main things that we have talked about as a committee, and some of the others have as well, is that the AI is a tool that is already out there. It's probably not going to be going away. Having a policy that just says you can't use AI may not be very effective. It may be helpful just to kind of try to understand it a little bit more, and then try to get a general understanding of how the AI can be used appropriately, or maybe what guidance you put forward in terms of practitioners and when they are using AI. So there's some information here about some of the risks and benefits, and some of the tools that individuals could use in their practice. So I found this to be kind of an interesting document. It's short. It's also just about 6 pages long. And there are some references to some of the federal laws and regulations, state laws and regulations, and then some of the other guidance documents by some of the professional associations, like the American Counseling Association or NBCC as is referenced here. There's also a note about licensees should use caution when considering AI tools in crisis management care. So as time allows between now and the next meeting, I would encourage you to read through that document as well. And I included two more documents for you under this umbrella conversation of AI. One of them is an article from the American Counseling Association on artificial intelligence. But the last item that I'll talk about today under this category has to do with a much larger document in your packet. It's about, I believe, 80 pages or 76 pages long. And this is a document about developing artificial intelligence policies for public health organizations. And one of the individuals who was a partner in creating this was the Kansas Health Institute. And I would recommend that you take some time between now and the next meeting and just familiarize yourself with this document. It is current and did just come out in January of 2025. But I think it has some good information here about some things to be mindful of and things to consider for organizations when they are considering putting in policies about the use of AI. So I would encourage you to take a look at that document as well. And so we've talked a little bit about it from a committee standpoint. I think one of the important things in our discussion has been how do we educate ourselves on this topic? And then two, what approach is best to take, knowing the role of the advisory committee is to make recommendations back to the board. So to help you in terms of this process, I just wanted to provide some more materials to you for your review. So I would, like I said, I'd ask you to take a look at this between now and the next meeting. If you have any additional comments today, we could definitely have some more discussion on the topic of AI, but just kind of wanted to give direction for a future meeting more than anything. So I'll go ahead and stop and see if there's any questions or comments on regulation of AI today.
I have a comment. So, you maybe know, I'm a private practice therapist, and I use the electronic health record system, Simple Practice. And I think a lot of marriage and family therapists use that because AAMFT partners with it, and they highly encourage it. But just as last week, Simple Practice pushed out an email about they're going to start, and I don't know when, it's in the future, but start offering a AI note taker. So that is from the briefness I've read about it. It's listening into your sessions. It's taking a transcript of your whole session, and then based off of that transcript, it's going to write a note for you that then you have to review and sign. And I just thought, you know, right now, if I wanted something like that, I'd have to look outside of my electronic health record system. So I think there's probably quite a few people that are kind of ignoring this topic. But with this maybe future opt-in that you can do just through Simple Practice, there might be a lot more people starting to use AI. So it does kind of feel like our time is ticking quickly on this, but I wasn't sure if everyone was aware that that's something that's getting pushed through Simple Practice, and just wanted to let you all know.
I got the email as well, Heidi.
Yeah, and I thank you for those comments because I think really there's been a lot of software packages on electronic health records that are coming out to do ambient listening or note transcription, and even those conversations have happened with the board. They've actually happened at the AMFT-RB, the review board that looks at those kind of things too. So, you know, I think the best thing now is looking at it in terms of HIPAA compliance and having some type of reliance on the fact that that software is appropriately vetted. But yeah, I mean, to your point, it's here and now. It has been here, and so it's important that as a advisory committee and then as a board that we're taking steps to figure out what that means in terms of regulation of the practice.
Yeah, it feels like it's not an if anymore. It's it's happening, and we have to figure it out.
Yeah. You know, the discussions I know that we've had, you know, from my standpoint, I think it's just been sensitive to the fact that we can't overly restrict something that evolves much faster than we could even regulate. So if we do step in with some type of regulatory action, then what is it that encompasses, protection of the public essentially, right? And that's really, I think, where if we focus attention on consent practices and compliance, HIPAA compliant practices, those kind of things, security, in technology, those types of issues seem a lot more attainable than some of the other pieces. Other comments or thoughts on this topic? And as Dave mentioned, I think our plan is to continue to bring things to the advisory committee. The board is going to continue to evaluate and look at use of AI and what makes sense, again, from that regulatory standpoint. But I think it's important that we keep, just like you're saying, what's happening now for clinicians and professionals, and what do we need to be paying attention to and responding to if needed.
I will say it is kind of tempting. Oh, you'll just write my notes for me? That's fantastic.
Yeah, and I think, again, there an evolution of thinking about these things as helper tools in the profession versus sort of a black and white version of it's all good or all bad, because there's certainly elements that are meant to really help professions and make things more efficient for everyone. So
And I do hope that whatever regulations are adopted include something on client education, because we will be way more versed in how we're using that tool than our clients. And I just think of some of my clients who don't like telehealth because maybe that's not comfortable for them, and then to think that somebody is listening to write the notes. So that transparency that we're going to have with our clients also might be how are we transparent with them.
okay, well, thank you for that. I would envision that we'll just continue to bring resources and thoughts to this advisory committee. And if the board takes some action, I'm sure we'll come back to advisory committees for input. But again, always, if you have thoughts, questions, concerns, resources, please send them to David or myself so we can think about those and get those distributed to this group. Okay. Now, David, I think we can get to our new item of business, which is really exciting.
I agree. I'll go ahead and share my screen here. You may recall back in the fall, we asked each of the advisory committees to discuss questions for a survey of licensees. And this is inspired by some surveys that we had helped the social work advisory committee with in the past. They had done a couple of different surveys where they asked their licensees questions to try to find out if there were issues from practitioners out in the field, trying to understand changes in the workforce, different things like that. And we've been having an ongoing conversation with some different groups around the state, trying to address the issue of workforce. And there have been some different statements made by different groups and individuals, and some of it is anecdotal, some of it is using a little bit of data and trying to extrapolate. And so, but there have also been calls for data at the national level as we all try to understand this and try to come up with solutions. And so in our role as being a board that is in charge of protecting the public, we thought this would be a great opportunity to ask licensees some of the important questions. And I was really, really happy with the feedback that we received. Just to kind of let you know our process is right now, we went ahead and surveyed 6 of the 7 professions regulated by the BSRB. Since we had most recently surveyed social workers, they were not part of the surveys this time around. But for the other 6 professions, we surveyed all licensees, and we also did somewhat, we tried to have consistency with questions. And part of that was to have a nice report per profession, but also at the end, we wanted to be able to do some comparative analysis across professions. And Kansas is unique in certain ways, in that we have tiered licensure for some professions where a lot of states may just have one level of permanent license. And professional counseling and marriage and family therapy are good examples of that. We're one of 17 states that licenses master's level psychology. I think we're one of a very small number that has a tiered licensure for that level of license. And so, so this information that we got back from the survey, I think will be really, really interesting. I'll go ahead and start walking through the report and then just kind of let you know how it's structured here. This is a draft report. I've been working with a couple of my staff members to try to quantify some of this and try to bring some summary information to you. For the marriage and family therapy profession, as of January, earlier this year, January 13th, there were 1,183 individuals who either had an LMFT license. There were actually 305 of those individuals, and then 878 with a clinical level license. So combined, we were talking about nearly 1,200 individuals. We did the survey. We were planning to do the survey originally for about 2 weeks. But after holding it open for about 2 weeks, some of the feedback we received was that individuals needed more time. And so we went ahead and held it open for about twice that long. We held it open for 31 days from January 24th through February 23rd. And the information that we got back was great. We used SurveyMonkey as a tool. We did use settings which were able to ensure that the responses were anonymous, but we also don't want to lose the voices of the individuals who provided comments and thoughtful consideration. A lot of the comments we got back were really, really helpful. And so what we decided to do was we decided to structure these draft reports in a way that we could focus on some of the questions that were asked, provide some summary information, but then as appendices, we went ahead and included the responses from everybody who took the survey. And so those are included, and I would strongly recommend that members of the advisory committee go back and review all the different responses to the survey, but we tried to glean some of the items that really stood out when looking at everything here. And so this first page talks about some of the methodology we used in terms of putting together the survey, the reason why we were doing that, and then sort of the high level impact of the survey. And so I mentioned we held it open for 31 days based on the number of responses we got, which were 296. That is about a 25% response rate for the survey, which I am pleased with. So 1 in 4 individuals responded to our optional survey. And for the LMFT, we had a response rate of about 22.6. And then for the clinical level of license, there was a response rate of about 25.9, so about 26%. I'll just walk through these questions. First, we started the survey with some demographic information to ensure that we had a good sampling of respondents. For the LMFTs, there were 68 individuals who answered the question, in what Kansas county or counties do you practice the profession of marriage and family therapy? So the most prevalent of counties that were referenced, Sedgwick County and Johnson County, which is to be expected as our high population centers. There were also individuals who listed a combination of counties in their responses as well. And the appendix on page 27 does list all of the different combinations and responses by people who submitted answers to that part of the survey. For clinical level marriage and family therapist, 226 individuals answered this question. The most common counties that were referenced here: Johnson County, Sedgwick County, and also Riley County. So those were the ones that were the most prevalent in terms of where people are practicing. Question 2, we asked both levels of licensing, do you practice in a predominantly urban area, rural area, or frontier area? And for LMFTs, it was about 69% that practice in an urban area, and then about 20% in a rural area. Just kind of food for thought. I did look at the 2020 US Census that talked about where are individuals living in Kansas. And I know this is a practice-related question versus where someone is living, but I believe about 57% of Kansans reported living in an urban area. And so this shows that the level of practitioners practicing in an urban area does exceed the number of individuals that are living in urban areas, at least according to the statewide reports for Kansas citizens. For clinical level licensure, the responses were similar. 225 individuals answered that question. The largest amount, 74%, reported living or practicing mostly in an urban area. And then 22%, just about, responded back that they practice primarily in a rural area. Question 3 asks both levels of licensing. Do you primarily work in public practice, private practice, educational settings, or a different setting? For the LMFTs, the number one response by far, with 75%, was that they practice in private practice. The next, actually all other responses were less than 9%. So number one with the bullet is private practice for the LMFTs. For clinical level licensure, still very, very strong private practice, 79%, but a higher percentage, 13% for public practice, and then small amounts for education and other. Question 4 asks both level of licenses. How many years have you practiced the marriage and family therapy profession? And we did ask individuals, if it's applicable, you can count the years that you practiced in other states. The responses on this were very interesting. The most common response to this, there were actually two answers that were about a tie. Over 10 years had about 28%, but also 2 to 5 years was about 28%, which is really interesting. I think if you look at the survey results from the other professions, usually the number one answer are the individuals who are long-term practitioners. So seeing the 2 to 5 year as one of the most common responses was kind of interesting. There was also a fair number of individuals who reported 1 to 2 years, so about 23%. And then for 5 to 10 years, 13. So you actually have a fairly good distribution across the different areas that we were looking. 7.2, less than 1 year, but there's a fairly good amount in each of the different breakdowns between the different categories. For the clinical level of licensure, 226 individuals answered the question. The most common response was over 10 years with 67%. And that is typical of what you would see for a lot of the other professions. 5 to 10 years was the next most common answer at 27%. And then all of their responses were less than 6%. Question 5, both levels of licensing were asked, including Kansas, and how many states are you licensed as a marriage and family therapist or licensed in the marriage and family therapy profession, if under a different title? 65 individuals that are LMFTs responded to this survey question. The number one answer was that they are licensed in one state, which is just Kansas. And I think that's reasonable. As I mentioned, Kansas is, distinct from some other states in that a lot of other states don't have a level of permanent license below the independent level. I think Ohio and Kansas may be the two that have that. And so it would make sense that individuals with an LMFT license may just be licensed in one state. For the clinical level of licensure, the most common answer was still one state, but it was a much lower percentage at 69% compared to 86%. The most common response, though, was one state. The next most common response, with a quarter of respondents, was 2 states at 23%. And then individuals that are licensed in more than 2 states was actually a fairly low number. 3 to 5 states was 6.3%, and then in the other category were either no one responded to those or preferred not to answer. So, question 6, we had heard from some individuals that perhaps they hold an active license, and unfortunately, this is one small typo from this draft report. it mentions LMLPs and LCPs. We use that as the template. That should be LMFTs and LCMFTs. But we asked a marriage and family therapist, do you maintain an active license but no longer work as a marriage and family therapist? If so, could you explain why you are not providing services currently? So for the LMFT responses, 43 individuals responded to that question. They identified different reasons why individuals could maintain a license without providing services. The survey in appendix on page 30 does include all those different answers. But to summarize their responses, the circumstances state in the question did not apply to 33 of them. They basically said they are still working as an LMFT. But of those who indicated they do maintain an active license but do not provide services, some of the reasons they cited were providing services under a license is not required for their current job. Possibly they're not providing services currently, but they maintain their license because of a health issue that they're experiencing or family care responsibilities. Some individuals may say that they provide supervision, so they hold their license but may not provide services. And then other individuals may be working in a different state. So they still hold the license in Kansas though. For clinical responses, 125 LCMFTs answered that question, and 107 individuals said this would not apply to them because they are still providing services. But other responses from individuals that indicated they have an active license but no longer provide services. The most frequent reported reason is due to providing services not being required for their current job. One of the respondents did note they plan to start providing services again soon. Less frequently mentioned items above, other licensees pointed out they maintain an active license for supervision purposes, or respondents indicated that they are either retired or a stay-at-home parent. So I found that interesting. You know, we've talked a little bit about how over the last few years there has been a shift to people staying in school longer. So for some of the professions that have tiered licensure where there's a bachelor's level and a master's level, there has been a decrease in the number of individuals at the bachelor's level, but a corresponding increase to the number of people at the master's level. And then for some of the professions that have the tiered licensure between a master's level and a clinical level, there's been a shift for individuals pursuing the clinical level. But we also know that individuals that are pursuing advanced degrees and at times higher level licensing, they may be more attractive to different organizations that would be looking for leaders to have someone come in and fulfill other responsibilities. So there may be individuals working in administrative type roles and hold an active license but may not provide services directly. So we wanted to just collect some feedback and see what individuals in the field would be saying about that topic. The next question, question 7, we asked LMFTs and LCMFTs, in a typical week, how many hours do you provide in-person services to clients? So for the LMFTs, 68 individuals responded to that question. The most common response was between 10 to 20 hours, 46%. And that was followed by 19% reporting 20 to 40 hours. We did not try to define in-person services, so it is sort of a broad term that individuals can interpret for themselves. In considering whether or not to provide a definition, you know, we know that there are things like working one-to-one with patients or clients. There's also the time that you would need to be doing things like paperwork. And so rather than get into the weeds, we decided to let individuals kind of define it for themselves. And so that term was open to interpretation by individuals who filled out the survey. After those two top responses, the 10 to 20 hours and 20 to 40 hours, less common were the individuals with 5 to 10 hours at 14 or 15%, and then less than 5 hours, which was about 12%. For the LCMFTs, the number of individuals who reported working 20 to 40 hours was the most common response at about 39%. And there were 226 individuals who answered this survey question. The second most common answer was 10 to 20 hours, and then less common were 11% for both 5 to 10 hours and less than 5 hours. We grouped this question with two other questions that are similar, just to get an idea of maybe some of the other ways individuals are categorizing their time they're spending. We asked, in a typical week, how many hours do you provide telehealth or remote services to clients? For LMFTs, 68 LMFTs answered the question, and the most common response by far was less than 5 hours per week at 66%, so about 2/3. This was followed by the next most common answer at 22%, which was 5 hours to 10 hours. So at least for the LMFTs, the majority of those individuals are not spending a lot of time on a typical week providing remote services to clients. For LCMFTs, the number one answer was also less than 5 hours, but it was less. It was a lower number, 59% compared to 66%. The second most common answer, though, was 5 to 10 hours, which was about 29%, followed by other answers that were lower than about 6% of respondents. So, that was interesting to get an idea of who's providing telehealth and how frequently people are providing remote services compared to in-person services. The next question we split. So the question we asked for LMFTs is, are you currently working towards attaining a licensed clinical marriage and family therapist, LCMFT license in Kansas? If you are not taking steps to receive an LCMFT license, please explain why you made that decision. So 66 LMFTs answered this question. 43 respondents noted they are actively working to pursue an LCMFT license in Kansas. For the respondents that noted that they were not pursuing an LCMFT, their common themes are included. They are having difficulty passing the licensing examination at the clinical level pass point. Financial difficulty due to repeatedly taking the licensing examination. Lack of interest in attaining a clinical license at this point in their career. Preference for ongoing direction and case consultation using the LCMFT license. There's actually some comments that you can review in the appendices there, that some individuals said they preferred to get ongoing supervision and comments and feedback on their work, and so they prefer to stay at the LMFT level to ensure that they were doing that. And then some individuals reported that a clinical license is not required for the current work that they're doing. And I know that this was a question that we asked for a few different professions because, as I mentioned, we have the unique structure, the 2 levels of permanent license. There are some states that what we would call an LMFT license, they might call a temporary or a provisional license, and they would say individuals can stay there for a few years, but if they don't reach the clinical level, eventually they can no longer practice. And that is not our preference in Kansas. But there was a question that had been brought up by a few different advisory committees. You know, this group of individuals that make up that category, are those individuals actively working to climb to the next level, or are they in that level and they're just staying there? And if they are, it would be helpful for us to understand that. So I think there's some really good answers. That's one of the ones in particular that I'd recommend checking out the appendices for some of those answers. As I mentioned, we split this question. So for the clinical marriage and family therapist, we asked those respondents in a typical week, how many hours are you responsible for supervising, managing, or overseeing the work of others? So when they were taking their survey, it basically followed how many hours per week are you providing direct services to clients, how many hours per week are you providing telehealth or remote services, and then how many hours per week are you responsible for supervising, managing, or overseeing the work of others? The most common answer on this was less than 5 hours, which was about 63%. And then 5 to 10 hours, I guess prefer not to answer, was at around 12%. And then 5 to 10 hours would be the next one there, at roughly 9% or so. And then the rest were very low. So at least that was not some way that they would categorize the majority of their time based on the individuals who responded to the survey. For question 10, we asked this to both LMFTs and LCMFTs. Do you anticipate retiring from the marriage and family therapy profession in the next 5 years? So this question, I think is helpful as we are looking towards the future. We are talking about helping individuals come into the workforce, and there's been a lot of efforts there, but it may be helpful for us to prepare for the future if we know, is there a profession that looks like there may be more individuals preparing to retire? The answer for LMFTs, 85% reported they are not planning to retire from the marriage and family therapy profession in the next 5 years. And about 12% said that they were unsure, which I think is a pretty common answer at about that number. 5 years is a long time, but it is helpful to get an idea, at least as far as how people are feeling today. In terms of LCMFTs, 226 individuals answered question 10. The most common response was still no, but a lesser number. For the LMFTs, it was 85% that said no. For the clinical level practitioners, it was 74% who said they do not anticipate retiring from marriage and family therapy profession in the next 5 years. There is a higher number of individuals who answered yes, and also a higher number of individuals who answered unsure. It's fairly close, though, in terms of the unsure answer, but the yes answer was 12% compared to just about 3% for the LMFTs. Now, maybe that is because some of those individuals are preparing to, they're taking steps to reach the clinical level of licensure, whereas the individuals who are at the clinical level may have practiced a longer amount of time. But interesting information to review. Question 11. We did ask, currently no multi-state compact exists for the marriage and family therapy profession. If a multi-state compact was created under a model that would allow individuals to practice in other compact states by changing from a single state license to a multi-state license for individual cost or additional cost, would you be interested in obtaining a multi-state license under such a compact? Please explain. And I do apologize for this. There was an error in the survey as it was created. This question was asked to the LMFTs, and it was intended to be asked to the LCMFTs, but it was inadvertently left off of that survey. But for the LMFTs, I think you would see probably similar responses for both categories. 68 individuals for the LMFTs answered this question. As you might expect, their interest in joining the compacts such as this would be very high. Some of the reasons why they said they would be interested in joining the compact would allow for better and easier continuity of care when clients move or travel out of state. Licensees who live near border states must frequently turn down new clients for not living in Kansas. And if this was something where our border states join the compact with us, we would be able to have more practitioner mobility, or at least do telehealth to serve those clients. A multi-state compact would allow licensees to move out of state with less uncertainties about the future of their careers. A multi-state compact would increase access to behavioral health services. Reciprocity and or managing multiple different licenses and boards is complicated. And a multi-state compact would allow licensees who want the ability to practice in multiple states to do so more easily. So I think some of those answers, I think that was what we expected. The model here that I gave for a compact is the social work model. So far, Kansas has joined 3 different models, but just my guess, the most prevalent model I can think we could see from compacts moving forward may be the multi-state approach. I'm not sure, but I'd at least pick one path and then allow people to respond to that one path versus making it vague. And so found that to be interesting. For question 12, we asked both LMFTs, and this was actually question 11 for the clinical level of marriage and family therapist. To assist the work of the board, the BSRB has 7 standing advisory committees, one for each of the professions regulated by the board, which are primarily composed of licensees in each of the 7 professions. Advisory committees discuss topics relevant to the work of the board and make recommendations back to the board on potential changes to statutes and regulations governing the profession. These meetings are broadcast on the BSRB YouTube channel every other month on a scale of 1 to 5. How familiar are you with the work of the Marriage and Family Therapy Advisory Committee? So for LMFTs, 69 individuals answered this question. The majority, basically 62%, said they were not familiar with the advisory committee. The next most common answer was about 24%. They were somewhat familiar, and then about 13% said they had an average level of familiarity. For the clinical level, marriage and family therapist, 227 individuals responded to the survey question. The majority noted no familiarity with the advisory committee, 63%, followed by individuals with some familiarity, about 18%, and then average familiarity at about 12, and then all the rest were under 4. And I know that if individuals don't serve on the advisory committee, I wouldn't expect that they would be completely aware of all the work that you do here in this group, but your work here is very valuable. And I think licensees, would benefit from hearing these discussions. So part of the reason this question was on the survey is to bring greater awareness to the advisory committee work. And we did get some nice feedback in the question that said, I was unaware the advisory committee met or that these meetings were broadcast over YouTube, but now that I'm aware, I will make an effort to become more familiar with some of that work, which I think is going to really help us out in the long run as we want more people to be aware of the different changes and mindful of the statutes and regulations and the requirements. And so I think just asking this question will benefit us. And perhaps if we do another survey in a few years down the road, it'll be interesting to compare these results to something that we might have in the future as more people follow the work of the advisory committees. Question 13 for the LMFTs, which is also question 12 for the clinical social marriage and family therapist. Over the past 2 years, based on your observations and experience practicing in the marriage and family therapy profession, could you share information on any practice-related negative issues you have seen, such as areas where practitioners appeared to need more continuing education or training in a certain area? So now, in terms of the public protection role of the board, we're starting to get into some of the meatier questions and some of the good feedback that we can work on as an advisory committee, and also that can get funneled to the board. So for LMFTs, 48 individuals answered this question. 14 respondents indicated seeing no practice-related negative issues, which is great feedback to receive. We would like to identify some areas of concern, but if individuals are seeing positive things out in the field too, that's helpful for us to hear. A couple of those respondents that noted no negative issues indicated that they have seen issues in other professions, but not in the marriage and family therapy profession, which is also helpful to hear. Practice-related negative issues that others reported, including items affecting things like insurance, diagnostic concerns, a lack of self-awareness, and a lack of continuing education options. Other practice-related negative issues talked about related to ethics, practitioners, and training specifically. Ethical issues reported including standards are not consistent across professions. There's no guidance for resolving professional disputes, and current ethical guidelines are in need of updating. Practitioner-related negative issues reported including things like conflicts of interest, lack of employment opportunities, practitioners imposing religious views onto clients, and sexism. Additionally, various areas requiring more training were reported, including CBT, ADHD, neurodivergence, documentation, and somatics. For the clinical level of practitioner responses, 175 individuals answered this question, identified a range of practice-related negative issues. 44 respondents did indicate seeing no practice-related negative issues. However, for the individuals who did note practice-related negative issues, it can be broken into about 6 main categories or areas. Ethical issues, court issues, artificial intelligence, telehealth, areas needing more education or training, and other issues. The following ethical issues were reported by licensees: boundaries with clients, social media, AI use, unethical billing practices, HIPAA violations, dual relationships, practicing outside one's scope of practice, abuses of power, manipulation, use of non-evidence-based practices, personal biases, marriage and family therapists providing legal advice, and client exploitation. Some of the court issues reported centered around the need for more education and/or training in court documentation, the role of therapists in the court system, and working in the courts in general. The following AI-related issues were reported by respondents: a lingering risk of confidentiality breaches, concerns about general AI use in practice, a need for ethical and legal guidelines on AI, a desire for more education on the potential implications of using AI, and issues pointing out regarding telehealth included the fact that regulations are lacking. Additionally, licensees expressed a need for more guidance on confidentiality and location of client requirements. 54 respondents spoke solely of areas needing more education or training. Specifically reporting areas included working with insurance and billing, trauma, diagnosis, working with children, documentation, treatment plans, EMDR, crisis, knowing when to refer out, diversity, and suicide prevention, assessment, and ideation. Other respondents pointed out communication issues between clinicians, a lack of self-awareness in therapists, and an increase in burnout. So a lot of good topics and a lot of helpful feedback and points of view that will be helpful to review. As I'm going to make sure that you all are reminded a few times as we go through this, those appendices are really helpful to see all the specific responses. And while we did, the staff did a great job here trying to summarize a lot of these issues, I do think it's helpful to read some of these comments in the respondent's own voice. So I would encourage you to review those topics on page 40 in the back on Appendix 8. Question 14 for LMFTs and question 13 for LCMFTs. Over the past 2 years, have you experienced any issues concerning telehealth, either through professional practice or observations of other practitioners? For LMFTs, 54 individuals answered the question. 40 respondents indicated experiencing no issues concerning telehealth. And then after providing this response, some licensees mentioned that while telehealth has increased clients' access to services, they still prefer face-to-face services. Frequently reported issues concerning telehealth from this group, though, were telehealth issues concerning the location of client, connection or internet issues, confidentiality or privacy concerns, and the inability to continue services if the client is out of state. For the clinical level of marriage and family therapist, 179 individuals answered this question. 121 respondents indicated having experienced no issues with telehealth. After providing this response, some respondents added more information. The following information was gathered from the responses who indicated having no issues with telehealth. 10 respondents expressed support for telehealth. Telehealth makes it possible for more people to receive services. 6 people said that. Telehealth has increased access to services in rural areas. 5 people noted that. Licensees might benefit from more clarity on the rules regarding telehealth across state lines. And licensees like having telehealth as an option, even if they choose not to use it. While the feedback following reports of no telehealth issues are mostly positive, some report not supporting telehealth and believe that in-person services are more effective. 2 respondents indicated that they do not provide telehealth at all. The following were frequently reported issues experienced concerning telehealth. There were concerns about, quote, the location of the client requirements, hurting continuity of care, HIPAA or confidentiality concerns, internet or connectivity issues. There were also concerns about licensees providing telehealth services for their own benefit rather than that of the client, confusion regarding telehealth guidelines, comment that telehealth is ineffective, clients not being in privacy or in private for therapy sessions, and poorly trained and or inexperienced clinicians providing telehealth services. 7 respondents, while sharing telehealth related issues, also expressed their gratitude for telehealth increasing accessibility to services. 6 respondents expressed that telehealth is not suitable for everyone, particularly children. Question 14, we asked the clinical level of marriage and family therapist, how many individuals do you currently provide supervision to? We had heard from some other states that one of the issues that they're experiencing are supervisors that provide supervision to a significant number of individuals. And so we wanted to get some feedback on this issue. The number one answer with 56% was that individuals preferred not to answer. And unfortunately, this was due to an error in the drafting of the survey. There was no option for people to answer 0. And so for the individuals who are providing supervision to no individuals, they could not answer that directly. So some of them in future answers, they noted they preferred, they used the prefer not to answer item on this. But aside from the prefer not to answer responses, the most common answer that individuals provided was 1. So most people are providing supervision to 1 person if they are providing supervision. The next most common was between 3 to 5. Then about 9% responded 6 to 10 individuals, and then 2 at about 6%, and then only about 5% said more than 10 individuals. So the vast majority of people seem to be providing supervision to somewhere between 1 to 5 individuals. For question 15, now we're synced back up again for both categories of licensure. Over the past 2 years, have you experienced any negative issues involving supervision? If so, please explain. So for the LMFTs, 56 licensed marriage and family therapists answered the question. Of the 56, 46 respondents indicated experiencing no negative issues involving supervision. And after providing this response, some licensees complimented their supervisor and or supervision experience, and others expressed how supervision allows for the sharing of experiences with others in the field. Some recurring issues that were reported by other individuals, including supervision being a financial burden on supervisees, being a lack of guidance and support from supervisors, and instances of supervisors inserting personal biases. For clinical respondents, 175 individuals answered the question on supervision. 35 individuals indicate they do not provide supervision. Of these respondents, only 1 reported interest in providing supervision in the future. 115 individuals indicated having no negative issues involved supervision. After providing this response, some respondents mentioned having positive experiences with supervision and or supervisors, while others reported a severe lack of training for supervisors. The most frequently reported negative issues involving supervision fell into 5 categories: training plan amendments, board-approved supervisor requirements, underprepared recent graduates, and other issues. Reported issues concerning training plans included confusion around seeing clients while waiting for training plan approval and around the role of emergency supervisors. Issues concerning training plan amendments included clarity around when exactly they are needed, as well as supervisees failing to submit amendments and consequently have to redo hours. Shifting to board-approved supervisor requirements, respondents reported there being a lack of continuing education and training available to meet requirements. Others mentioned that the requirements are too strict, making it too difficult to become a board-approved supervisor. The following issues were reported about the underpreparedness of recent graduates. Some mentioned recent graduates struggle with work-life balance. Recent graduates struggle with self-sufficiency skills. Recent graduates are unable to be proactive. Recent graduates have poor ethical instincts. And when reporting these issues, some respondents shifted focus to graduate programs, expressing a desire to understand why the programs are producing less prepared graduates. Other respondents indicated that it is challenging to find supervisors and supervisees. So now we're getting down to the final 3 questions. So we are getting close to the end of the survey. And after we finish our review of the survey, I will open it up for discussion and questions, but just kind of wanted to let you know where we're at in terms of our walkthrough. We have 3 questions left. Question 16.
I don't mean to interrupt, but I did share that I have to leave now. I have another event, a luncheon that I have to go to. So thank you for your work on this.
You're welcome. And yeah, have a good event and feel free to watch the remainder of it if you want to go back on the YouTube channel after later today.
Thank you.
Question 16, we did ask licensees, do you currently use artificial intelligence in your practice? And if you do, in what areas do you use AI? For LMFT, 69 LMFTs reported answering the question. 54 respondents indicated they do not use AI in their practice. After providing that response, some individuals mentioned hearing positive feedback from others, while others have privacy concerns on the matter. Reported uses for AI reported by licensees include treatment planning, note-taking and summarization, and template creation. AI was also reported to be used for marketing, research, social media design, and website purposes. For the LCMFTs, 227 LCMFTs answered that question. And that is found in appendix number 14 on page 60. We're trying to summarize the information here, but I think when we get to the final version of this report, that's no longer in draft form, I think we'll try to list some of the main AI tools that were identified by people. But 169 individuals reported they do not use AI in their practice. After providing this response, some respondents mentioned privacy concerns surrounding AI, while others stated that they are either considering or working towards implementing AI in their practice. The most frequent reported use of AI in practice from 14 individuals was for note-taking purposes, and the following is a list of other reported AI uses: email or letter generation, marketing purposes, list generation, and document purposes. Additionally, it was reported that the insurance companies use AI. It was also expressed that AI works well for writing purposes, but should not be involved in diagnosis or used without human guidance. For question 17, LMFTs and LCMFTs, based on your experience as a licensee in Kansas, do you have any recommendation on additional ways the BSRB could protect and serve consumers of services offered by BSRB licensees? For LMFTs, the response was 49 individuals answered the question. 27 respondents indicated having no recommendations to provide. Frequently reported other recommendations included prioritizing more communication between the BSRB and licensees, considering reciprocal privileges with other states or a multi-state compact, offering more online options and services, and developing ethical guidelines for the use of AI. For the clinical level of respondents, 161 individuals responded to this question. 86 respondents indicated having no recommendations to provide. The following is a list of frequently reported recommendations from licensees: establishing regulations and best practices for artificial intelligence, fighting for improved insurance reimbursement, allowing anonymous complaints, particularly when a licensee is reporting another licensee, speed up the investigative process, give more severe consequences for disciplinary matters, educate the public about the marriage and family therapy profession, prioritize getting more providers into rural and frontier areas, consider requiring peer consultation hours and suicide prevention continuing education with each renewal, add in statute or regulation language concerning professional conduct in the community, support expanding the ability to virtually see clients across state lines, and create a method for regular communication and updates from BSRB to licensees. Some respondents focused more on group and private practices, expressing that both require more regulated oversight. Additionally, it was requested that the BSRB advocate against harmful legislation. This being said, opposing statements were made as well, reporting that the BSRB should remove themselves from politics altogether. Question 18, last question on the survey. Do you have any other comments or feedback you think would be helpful for the members of the advisory committee to receive when evaluating possible recommendations for changes to the statutes and regulations for the marriage and family therapy profession? For LMFTs, 44 individuals answered the question. Of those individuals, 30 respondents indicated having no comments or feedback, aside from what they had previously mentioned to the survey responses. Over the comments, of the comments and feedback that were provided by other individuals, the most frequently reported recommendation was to either join a multi-state compact or find a way to make reciprocity easier. Comments and recommendations specific to the BSRB included loosening clinical requirements, the belief that the BSRB is too restrictive, prioritizing empowerment of licensees, and maintaining an up-to-date list of available clinical supervisors. Client-specific comments made regarding the challenges faced by therapists when clients are out of state and want services. Additionally, recommendations were made to specify for the public the differences between the professions overseen by the BSRB. Licensee-specific comments made to include the need for more behavioral health providers and commonly held view of feeling unsupported in the field. For the clinical level, practitioner responses, 149 individuals answered question 18. 90 respondents indicated having no other comments or feedback to provide. And then the following is a list of the most commonly reported comments or feedback from other individuals who completed that part of the survey. Prioritizing license portability across state lines or joining a multi-state compact. More communication or notifications from the BSRB was requested when changes occur. The high ethics and training standards in the marriage and family therapy profession are valued by licensees. More guidance on artificial intelligence. There's a need for accountability with insurance companies. There's a need for higher pay for marriage and family therapists. And comments and feedback directed to the BSRB or advisory committee pointed out that there is no language in statute or regulation that includes a community protection standard for licensees. Other respondents requested clarity on boundary and leniency in small towns, as well as on the under direction and location of client requirements. Other comments and feedback highlighted the need for more education in diversity, systemic issues, and LGBTQ plus population, sex and gender, and ethical and effective therapy. Additionally, the following comments and feedback stood out, reflecting potential issues. Licensees have witnessed other licensees ignoring conflicts of interest. Therapists need more support and fear losing their careers to online or AI services. And attention was brought to the issue of not having a way to report someone who's providing services but has never been licensed. And that is the report. We did want to organize this report differently than past reports. When we initially did the survey reports for the social work surveys, we tended to go question by question, and we were still learning the process, as we are today, of making good reports. And so our primary focus was to provide all of the answers up front. This time around, we decided to take a different approach and provide more summary information, but we do really value the individual responses for people who put a lot of time and effort and provided very thoughtful responses. So while the report itself is about 26 pages, the document is 77 pages, because after the first 25 pages, we included each of the open field responses as appendices. And so you can go through the report, see some of the other information that was provided. As I mentioned, a lot of people provided very thoughtful answers. Some of this was difficult to summarize. And so I do think it's really valuable for each of the advisory committee members to go back through and review. And, sometimes an answer was reduced to a yes for summarization purposes, but you can see how much additional information follows the yes. And so all of this is really, really helpful and good data. But this is the report for one profession, and we have profession and reports for 6. And so we have a lot of work to do. But I'm excited about this because, this is not a standard that other small fee-funded agencies are doing. We're kind of putting ourselves out there, and I am very happy and proud of the board for embracing this challenge, and for the advisory committees as well, for being brave to ask these questions and being open to the constructive feedback and also the challenging comments as well. I think it's important that we hear this information, and then some of these things may not fall under the board's jurisdiction, but perhaps this would open up a doorway for us to have conversations with different entities around the state. So I think the potential for this information to be helpful. I'm not sure what the limit on that is. I do think this could drive the work of the board and the advisory committees for the future, But I also believe, like I said, this could open up conversations to other state agencies, or once we have a nice set of reports, we could deliver those to or make presentations to other groups, and they could benefit from this as well. So really happy with where this is at in the process. We still have more work to do to clean it up, to make the final versions of the reports. We want them to look nice, and we want to do a credit to the people who took the time to respond to it. But like I said, I'm really happy with where we are today. So I'll go ahead and stop sharing my screen and just open it up for comments and questions from any members of the advisory committee.
Well, I'll just start by saying thank you for accumulating what you have so far. I know this is a lot of work, particularly because you've done this with the other professions too. So I know you and your team are working really hard with it. I know certainly I would like to read it more, and I think and make sure all the other advisory committee members have the opportunity to do that as well. But it definitely seems like there will be opportunity to categorize things like in professional education, and telehealth. There's already like really good AAMFT supported telehealth guidelines. It's like, how do we get those resources in front of the professionals in our state? But just seems like, and then I know you and I've talked about, just maybe people aren't aware of the things we've already changed, because some of those things rose out of those comments as well. But the immediate response I had when I was thinking was, the BSRB has taken on these educational forums, and perhaps there's an opportunity to have one specific to the profession, so that there's some level of feedback loop on the survey, things that could be addressed. I don't know, it just came to my mind as you were going through some of the material. But other thoughts, comments from advisory members?
I thought it was interesting seeing the difference of practice setting, and I questioned, like, oh, is this just like private practice people have more time to fill out the survey, or do we actually have that, like, not that many working in the public practice or education, or things like that. I thought that was particularly interesting. And then the people who have maintained an LMFT for 10 plus years, I thought that was really interesting, because I guess that wouldn't have been what I expected. I would have expected it to be a shorter, I think the second most answered was like 3 to 5 years or something like that. And that kind of makes sense to me. But yeah, just lots of people maintaining a license that's not a clinical license, because they don't need it for their job, or because they aren't interested in getting a clinical license. And I thought that's just really interesting. And then also, I wonder how much that pairs with those supervision questions of, like, having a hard time finding a supervisor, or finding someone that you can afford to pay to do that. So I thought those were particularly interesting questions and responses.
I agree. Yeah. So I mean, again, I think this is an opportunity for us to really look at how, as Dave mentioned, like how this can inform maybe some of the priorities we take on in new business here, because I think there are some actionable items we can really take from this. So I'll be curious to see when the other advisory committee members are able to look through it. And then we can sort of come up with an action plan, maybe, or begin talking about that from the next meeting. Like, what are the things we can learn from this to help our profession? It's really good stuff. Yeah.
I agree. I'm a big fan of data, and I sit in committees sometimes and I hear different perspectives, and it's helpful to hear the perspectives. But sometimes people, they have one viewpoint, and they do anecdotal responses based on their perspective. But I wonder sometimes if the data would really back up some of those positions. And so being able to ask these questions to all licensees and collecting all this information and getting it back, while it's not 100% response rate, I feel like 25% is still pretty good. for a voluntary survey. And it's just helpful to kind of hear back from actual licensees as far as their thoughts and concerns. And so I'm really excited about working through all this information with all of you. And I apologize, I should have started with this, but I mentioned a couple of staff members have really helped me with this, and I was meaning to identify them by name, but Emma and Tyla have been wonderful. They have spent a lot of time really working with me and summarizing a lot of the information, or working on, putting information into the charts while I've been working on another subject. So the three of us have spent a lot of time, and we've moved quickly because, as you mentioned, Mary, we have one of these for each of the professions, and so we're going through and trying to do a lot of these this month. I think this is the fourth one that we have completed, at least in draft form, and we're going to be doing a few more before the board meeting coming up next month. So, but yeah, really excited about it. It's nice to have good data, and I'm excited to see where we go forward from here. So,
Yeah, great. Thank you.
Sorry, Mary. I think it could be also interesting to see some of the similar themes between professions too. Like, are lots of counselors also concerned of the same things, or social workers? Or I think that would help the main board have a really clear direction of what way to go.
Yeah, I think that's an excellent point. And there were a lot of similarities across questions. So that will help kind of look at maybe some larger themes for the profession in general. Great thought. Okay. So we have discussion of adding advisory committee members. We don't now have a quorum, right? David, is that correct? To make any action item?
well, basically, most springs I follow a standard practice, and so I can move forward on that. I
Okay.
want to kind of collect feedback from you all. Every spring, I look at the advisory committees. Then the advisory committee policy does say that there can be between 3 to 10 non-board members on the advisory committees. And you currently, I believe, have 6 non-board members on your advisory committee. And so you would have some availability if you wanted to add members. Generally, if the advisory committees are not full and there's no real strong objection from the advisory committees, what I tend to do is to send out a letter or an email to all licensees, let them know the advisory committee is accepting letters of interest and copies of resumes or CVs for anybody interested in being considered to join the advisory committee. And then you can review those at your next meeting in June. You don't have anybody who is scheduled to come off the advisory committee. I usually try to provide those updates too. Individuals can serve up to 4 terms on the advisory committee, and those are 2-year terms. At that point, they would have to come off the advisory committee. The board recently decided that members could come back, but there would still need to be a 2-year gap in service before being eligible to serve additional terms after that. So nobody on your advisory committee is reaching their maximum length of service, but you do have a little bit of flexibility now. So you don't have to decide today how many new members you would like to accept, but if there's no objection, I can send that out. And then once you receive that back, you can make a determination as you review candidates, how many open spots you may want to fill.
I think based off of our little meeting, we might need some more members.
Yeah, I think it ideally, because we had one point sort of had this mass exodus of members, this idea of bringing 1 or 2 on every year is a really smart way to go. So, okay, as long as it's a practice you've been doing and we don't have anything we need to vote on, I think it'd be great if you could get that started for us.
Okay. Yeah, I'll go ahead and start that process. And then also there are individuals that, as I mentioned, they're serving 2-year terms. So I'll do a review. If there's any members of the advisory committee that are coming up on the end of a 2-year term, I'll check and make sure that they are interested in being reappointed for another 2-year term. So I may be reaching out to advisory committee members about that. But then if they are interested in being reappointed, I tend to refer those to the chair of the board, which is also the chair of your advisory committee, or previous chair of the board. But that would be something that the chair of the board would have the ability to appoint back to the spot. And so I'll be in touch with anybody if their 2-year term is going to be up for at the end of June 2025.
Okay, great. Thank you. Anything else for the meeting today? Or as always, we would invite you, if there are topics that you're interested in bringing forth, let Dave or I know, and we'll make sure to get them on the agenda. But if there's nothing else today, our next meeting is scheduled for June 13th at 10 a.m. Okay, well, it looks like you'll get a little bit of time back in your day. Thank you. Thank you, Dave, because I know you had a lot to review with us today and a lot of talking points to get us through. So thank you for your work today as well.
You are
There's
welcome.
nothing.
And
There's nothing.
Now, I know I've given you a lot of homework between the artificial intelligence documents, this report, but I think you'll find it very interesting. So looking forward to continuing more of the conversation in a couple months.
Great. Thank you so much. Okay, well, if there's nothing else, I'll take a motion to adjourn.
And actually, Mary, since we don't have quorum, we can't.
Oh, we don't have to, right? That's right.
We can just go ahead and consider the meeting adjourned.
We're just going to agree that the meeting is over. All right. Thanks, David. Thank you, everyone. Have a great weekend.
All right. Bye.